I know that a lot of times someone who has NPD does not go for treatment. But let's say there are the occasions where they do.
Mm-hmm.
What can they do? Like, is it hopeless? Can they be treated?
So again, we have to look at the
Because I think about like, okay, I've got if I'm left-handed, but I want to learn how to throw, if we're talking about,
yeah.
being hereditary, like I'm left-handed, I throw left-handed, I brush my teeth left-handed. I want to learn to throw right-handed. I want to start brushing my teeth right-handed. I know that's very simplistic compared to what we're
No,
talking about,
that's a
but
perfect analogy because what would it require for someone who's left-handed to become right-handed? Is it possible? Yes.
it's possible. It's just tough.
Well, just like it would be very tough for someone who's trait introverted to become an extrovert, but they could do it. So we have to look at narcissism that way. Narcissism is what's known as an ego-syntonic disorder. The person who has narcissism is not perceiving that the problems are originating within themselves. So they don't see any need to change. Just like an introvert, they don't want to try to, not a lot of introverts want to try to be extroverted. Maybe some of them want to, and if they want to, they are going to have to try. It's going to be a lot harder for them than somebody who's a little bit more naturally extroverted, right?
Yeah.
So it's the same thing. It's like they don't have the mechanisms naturally to do it, but if they put a lot of effort, we're talking a lot, some can improve. And so we've seen this with mild to moderate NPD, if we're looking at the dimensional model. If they have the right intervention and the right therapist, and they have enough collaborative capacity, which that's not going to be a consistent thing. I mean, you anticipate dropouts from therapy with narcissists a lot, but they've done studies on mentalization-based treatment, schema therapy, transference-focused therapy, where those have actually shown to be very promising for people with NPD. Now, people who end up in therapy, it's not true that narcissists don't go to therapy. They don't go to therapy announcing they're narcissistic. They go in for depression, they go in for substance abuse, they go in after they got laid off, they go in after they got in a fist fight, they go in after they're, getting threatened to be divorced. So they show up a lot. It's just that they don't show up and say, I'm a card-carrying narcissist.
Right.
So, but if a therapist gets one in the room and they know how to assess for it, and they also are trained in mentalization-based treatment or schema therapy, there's a good chance that some can improve. But it's not like, we're not talking about 4 sessions. We're talking about a long term. There's research that shows that for every 1 therapy session of a high functioning non-personality disordered person, a personality disordered person would need 6.
Oh, shit.
Right? So now add
Wow.
that up, right? So let's say a person who is struggling with anxiety goes to therapy through their insurance 42 times a year. For every one of those, you'd need 6 for a
Oh my
personality
gosh.
disorder,
But
right?
there is hope. That's the big thing. There is
In
hope.
some, in
Yeah,
some.
there's some.
But we have to remember too, it's not in their nature to collaborate. So
Yeah.
as soon as they hear something they don't like, they typically start devaluing and demeaning the therapist. They think they deem them incompetent, and then they drop out. It's a fine line with that relationship and that treatment frame. And there are professionals who have dedicated their entire careers to treating personality disorders. There's a really, highly credentialed, incredible pioneer in the field named Joel Paris. He's a
Mhm.
Canadian, well, he works in Canada, he's a psychiatrist. He's opened 2 clinics specifically for the treatment of BPD.
Really?
Yeah. He's
And success?
he's also the one who does the research on a lot of them come in and report they don't have any trauma histories. So if you want to look at the data there, it's fascinating.
Wow.
But
And
yeah,
he's had success.
he successfully treats them. There's a book called A Concise Guide to Borderline Personality Disorder. It's like less than 100 pages. He talks about the best interventions and treatment efficacy and things like that. So, but it also does operate on a continuum. I mean, there are
Yeah.
severe cases where people are malignant and abusive and dangerous, and they're never gonna change. They don't want to. That malignant nature is working for them.
Wow. Okay. Well, I'm gonna leave it with the positive note. There is some hope there.
There's some hope for some, yeah.
Yeah,
And
some hope for some.
even with BPD, they're the most help seeking out of the cluster B personalities because 90% of the time they have a comorbid condition, like a mood condition or something else that's really interfering with their life. So that's actually bad for them, but it's good in the sense that that's what motivates them to go seek help, is their mood disorder or their eating disorder or something like that. Hopefully they can get into the right hands with the right clinician when they seek help, and that therapist can treat the behavior that needs to be treated in addition to the mood problems.